Unconvertible joint problems, these are almost invariably ipsilateral to the side flexion loss. So if I can't right side flex, it is almost always a loss of the inframedial glide on that side. So one way of manipulating this is to thrust through the glide, an arthrokinematic manipulation. So we want to safeguard the segment a little bit, particularly the artery. So we'll do this in maybe neutral, possibly a little bit of extension or maybe flexion, but not at an extreme of range, certainly not an extreme of flexion, of extension rather. So we can have the head up here. This soft spot again goes against the transverse process. We'll translate it across to get to the end of range of side flexion there. Now I'm not doing this with the head, I'm not side bending the head at all. It's all being done from this right hand pushing across. Okay, there. Get the end fill and thrust inframedially. Not a bad technique when it works, but it often doesn't work. So the alternative is actually to do a distraction type manipulation on this joint. Now, the way this joint sits, it's in this plane. Actually, I'll show you better on this side. It's in this plane. And so when I do axial rotation, that tends to happen. So that's what I'm going to try and get. So again, from this side, and then I'll do both of them down from the other end. This one we do in a little bit of flexion because there is rotation involved here, and I don't want to rotate in extension because of the artery. Now this part of the finger comes behind the neural arch on the right side. This is a right side flexion loss again, remember. There. So I've got him cradled here. I'll translate him to get that range of movement. Lift forwards on this transverse process, which gets me to the end of the axial rotation, and the thrust is into axial rotation. Do it on this side. It'll be this. There. Let's do both of these from the other end. The arthrokinematic manipulation. There, anywhere around the neutral position. Soft spot against the transverse process, translate across, there, thrust inframedially, there. The rotation one, again on this side, flexion this time, or not full flexion, but inflection. That part of the hand on the neural arch on this side now, translate it across, get the end of range, lift it to get the end of range, and turn it to manipulate it. On this side, that. So you're trying to actually produce axial rotation. Okay, for the unconvertible joint, for the arthrokinematic glide, we do want to be on the side of the neck, on the tip of the transverse process, again with that soft spot there. So it's that. Somewhere around about neutral, we'll translate to get the end of range and then thrust inframedially to regain the movement. If we're going to do the unconvertible joint with rotation, we'll use that part of the hand and come underneath the transverse process now. So we're on the articular process with it there. Neck will be in flexion. We'll translate to get the end of range, lift it on that side into axial rotation, get the end fill, and then thrust with a small rotational amplitude maneuver. For the other unconvertible joint technique, where we're using rotation, we'll use this part of the finger now, and this will go under the neural arch rather than on the tip of the process. So we want it in flexion now. This will go along the neural arch here. We'll get the translation to get the end fill, lift it on this side anteriorly to get the axial rotation, and then the thrust is just a continuation of that lift there. Like so.